Hi, I'm Kate Wayman. I'm one of the nurse practitioners here in the Yale Children's Diabetes Program, and I am going to be speaking with you today about sick days. Sick days are very important to be aware of because it is managing diabetes when you're sick can become a little bit more difficult. So the number one thing to remember here is we're not just talking about like a sniffle or a very mild illness, but actually a day where you're like sick enough to just be home from school, home from work, you know, kind of just laying around on the couch. And when your body's under stress in these situations, because it's fighting off an illness, you actually can have some issues with managing your blood sugars and also making it more difficult to potentially control ketone levels that can build up. So if your body is busy fighting off an illness and there's more stresses, you actually may end up burning some more fat, and that actually can turn to ketones. And if those ketones build up, that becomes, you know, to high levels, that can become an emergency that's known as diabetic ketoacidosis. So this is why we never want someone to stop insulin. If they were ill, you may need less, but you never should stop insulin. You should always call us if you develop ketones. So the most important thing is just to know that you're going to need to be checking frequently for ketones when you are ill. Another side note is just to realize that if your child is sick, most of the typical over-the-counter medications that you use prior to diabetes are still absolutely fine to use. Now that they have diabetes, there's sometimes a warning label that says if you have diabetes to talk to your doctor. That is not something that you don't necessarily have to call about. So using things like Motrin, Tylenol, allergy medications, those are typically all fine to use once you have diabetes as well. So again, never stop insulin. If you're vomiting or so nauseous that you cannot eat, we need you to give us a call. We need you to check for ketones. And when you're sick, you're going to need to check your blood sugar and your ketones every few hours around the clock. So some guidelines, if you're not vomiting, we want you to actually make sure you stay hydrated. So that involves taking sips of clear fluids. It's about a tablespoon every 15 minutes. And it depends on if your sugar is either above 180 or below 180, whether you're going to use sugar-free fluids, or if you're going to use fluids with sugar. So we gave you some examples on these slides. And in your book of what has sugar and what doesn't have sugar, and that magic number is kind of 180. So in summary, really do not stop insulin. It's extremely important. Even sometimes when you're sick, your blood sugars can actually be low or low normal. You wouldn't think that you're making ketones, but it's actually like not enough insulin that causes ketones to be formed and not high blood sugars. So we need you to still take some insulin. Call us if we need to come up with a different dose, but never stop insulin altogether. And another situation to be aware of, if your blood sugar is running low and you're throwing up and you can't drink anything or keep anything down, there is something you can do. One is taking a bowl of sugar, mixing in some cinnamon, actually having the child dip their finger in that, lick their finger, dip it in that, and then suck on their finger. That kind of gets some sugar absorbed through the mouth into the bloodstream. And also there's something you can do that's called like mini doses of glucagon, where you would, if you have a glucagon kit, you can actually mix up the glucagon, you get an insulin syringe, and then you draw up 1 unit for every year of age for 2 to 14 years. If you're 15 plus, you just give the 15, and if you're under 2, you just give the 2 units. Also, if you alternatively have the Baqsimi nasal glucagon, you can go ahead and use that. And that's a way for the blood sugar to raise the blood sugar without taking anything in orally. In your booklet, you'll find in the back some flow charts about what to do when you're sick, and we made these up so that people can put these in their house and just kind of follow them and know which steps to take, and also when to call us. And there's one for pump and one for injections. Please refer to those. Thank you.